Okay, a thought. Hospitals are bad for your health. So if you have any choice, don't go near them. About 134,000 Medicare patients had what are called adverse events. You know what I mean about language by now, right? What it means is wrong medication, infection, they fell out of bed. Most of this probably could have been prevented if they had more nurses on the floor. The reason they don't have more nurses on the floor is because hospitals would prefer to pay insurance companies than they would to pay for nurses. Now, how are we going to switch all this around? One of the things you can do is try to be a difficult patient. I know it's hard, but try to do it. Every time a doctor or a nurse talks to you in jargon, ask them what they mean in English. Make sure that you get an explanation that makes sense to you. A little tip and something you might not know is, again, to make sure we cut down on wrong site surgery, do the magic marker thing and mark the thing that has to be removed or not or worked on. The other thing that you can do is make sure that the night of any operation that you have somebody staying with you that night. Even if you have to ask people for a Christmas present and ask them to pay for a companion or somebody to stay with you overnight who can be there just to make sure that if you get sick and you have to be sick to your stomach or go to the bathroom or whatever, you don't have to do it alone, because before anesthesia wears off completely, you're not as sharp as you could be. But notice, these are, again, Medicare patients. And the bottom line, as long as there's the bottom line, that's supposed to be the banner on healthcare, we have a problem. The other thing I think I would ask now for everyone, and I would ask you to think about this, is why would they have a nurse sitting watching a heart monitor instead of a technician who can call for a nurse while the nurse is with the patient? Why aren't we putting our nurses who have studied for long and hard to be with patients and to be able to assess them? Why aren't we putting them by the patients and putting technicians in front of monitors? That's just a thought I had the other night. I think that the business of nursing does more than just hurt patients, though that's no small thing. What it does is it interferes with the feedback mechanism that keeps doctors and nurses in hospitals and in caretaking to help their patients. Because what it does is it breaks up the circle of intimacy, the circle of responsibility, where the doctor knows the patient, the nurse knows the patient, and notices the subtle changes. You can't see what's happening with someone if you come in for 3 minutes. If you know somebody for a year or two, five days you've been watching them, you can tell the subtle changes. They won't get sick and die on you in the same way as if you're taking care of medicine, a blood pressure, wrapping a leg, and if all these parts are being taken care of different people. I think it's time to stop all the separations. I think it's time we become whole again, we become one again, and we have a nurse or a doctor taking care of a patient. All three of these known as people.